All right, hello everybody. Welcome back to Macros and Micros. This month we went over omega-3 fatty
Yep.
acids,
hmm
but we also are manual therapists by trade as well too. I am Dr. Emery Pitcel of Rothrock Chiropractic and Rehabilitation.
And I'm Dr. Maggie Sopic of Chiropractic and Functional Medicine.
Yeah. Now, last month, if you followed, we'll put a link to the YouTube on this, but we went over a really comprehensive progression of forces using the McKenzie method of
Mhm.
therapy, starting with patient doing retractions with a patient
Yeah.
overpressure. We showed how we could add clinician overpressure, and then we finished it with a mobilization. And all of those are great. And what Maggie and I were talking about before we jumped on to this video here was that both you and I, correct me if I'm wrong, both
hmm
you and I like to start with doing exercises before we just jump
Yep.
right into adjustments, correct?
Yep.
All right, give them some of the explanation as to why we do that.
Well, yeah. So we want to make sure that we can get to that range of motion and that it's comfortable, and that we're not putting too much of a force into an area that's not prepared for it, essentially.
Yeah, exactly. So what I heard there is safety, right? But
Yeah.
I always like to think in all things that we do in practice, safety's got to come first and then effectiveness needs to come
Right.
second, right?
Yeah.
And so I think you and I both think that we progress through forces so that we have safety in mind first. Like if you could barely do a retraction, if we go and we do one of these adjustments that we're about to demonstrate, that's going to definitely make you worse instead of better, right?
hmm
And that's not the ultimate outcome. So
Right.
by keeping the safety in mind, you actually get to the effectiveness and the clinical reasonable change that you
Yep.
want to see, right?
Right. Exactly.
So I think we're teasing everybody enough, and I'm
Yeah.
sure everybody wants to see some neck adjustments. So the way we were going to structure this video is I was going to demo neck manipulation on Dr. Maggie. I'll show kind of how I like to do it and
Yeah.
how I like to set it up. And of course, all of this would be following a bunch of like soft tissue work and exercises. We want to
hmm
just jump right into it like we're going to do here,
Right.
but
Right. Right.
we know you don't want to sit for 5 minutes to watch me stretch her,
Yeah.
probably.
Yeah.
And then we'll flip flop, and Dr. Maggie can maybe give a little bit of
Yeah.
clinical talk and demo, so that way you could kind of just sort of see how we both like to adjust cervical spine when clinically reasonable, called for, safe, and all
Yeah.
those other things ruled out first, right?
Right on. Yeah.
Yeah.
Perfectly said.
Shall we?
Let's do it.
All right. I'm going to have you lay on your back so you're face up here, then, please.
Okay.
All right. So, like I said, with her, we would have done some exercises first, and then we would have done, some soft tissue work and stretching and everything. But I really like to do, because we find that a lot of neck cases need typically retraction or some sort of extension move because our world is so stinking forward. We all
hmm
struggle with poor posture. When we get tired, our head drifts forward. We're looking down at the paper and the dishwasher and the laundry that we're folding. Everything is kind of pulling us forward. And so rarely throughout the day do we actually reach an end range or terminal extension. That's why an
Right.
adjustment feels really good, is because you're basically giving somebody a massive blast of what they're not getting enough of. So I'm going to demo on both sides, but I like doing a rotation combined with an extension move. So to get that, we would take Dr. Maggie's neck over to the side here and first kind of just feel where it's maybe the most restrictive, which I think I'm picking up is right about here, maybe
hmm
C3 to all the other chiros or manual therapists out there. And then her job is to just stay nice and relaxed here. And we're going to kind of go and just give it kind of like a flip and a push to keep the extension and the rotation going. So kind of like that. How'd that feel, Doc?
Good.
All right. And then for sake of quick demo, other side here. I'm going to say you probably needed a little bit more right there. And here's the nice thing. We like to try to maybe claim that we're super, super specific as adjusters, but the reality is regardless of if I make the contact as the fulcrum point at C1, C2, or if I do it down at C7, C6, we're still getting effective movement throughout the other entire chain.
hmm
We're just trying to make sure that we adjust through what feels like the stiffest, the most hypomobile area, so that we're not putting more force through a spot that already has enough joint play,
Right.
basically, right?
Yep.
Okay, how about
Okay.
we trade?
Yeah. Let's
Sound
switch.
good?
Sounds good.
All right. I imagine you want me face up?
Yeah.
All
Go
right,
for it.
cool.
Yep. So this will probably look very similar, like as I was, but right now I'm just gonna palpate and just see, Yeah,
that'll probably help a
that
little
would be
bit.
helpful. So
Yeah.
yeah, with my care, I'm just palpating to see any restrictions, and then I do some motion palpation as far as like where are we going or what movement do we have or not have so much. So kind of in that similar um, way that you do it too is feeling for that rotation versus and extension as well. So I'm just kind of like playing into that joint and seeing. So yeah, I normally tell my patients take a nice breath out, go to your happy place.
Mhm.
Feel okay?
Yep.
Okay, and then same deal here. Just going a little bit higher up and boom. There we go. Feel okay there too?
Yeah, absolutely.
Cool. And then, yeah, we, like you mentioned, follow up with some um, more exercises that are appropriate and with some other manual therapy, some soft tissue work just to, again, like enhance that experience.
Absolutely.
Sound
Well,
okay?
yeah, it does. Well, let's move back over to the
Yeah.
chairs here and everything. So we'll switch
Sounds
flip
good.
flops. That
Yeah.
way, if people skip to the end, they'll be like, "What? They
Yeah.
swapped." All right. Well, hopefully that was beneficial to see. We hope it was a little bit of a trust builder, and we know that I could guilty confess this. Part of the reason why I wanted to become a chiropractor is I'm a little bit of a crack addict, right? So it's nice to hear the pops, but what we always emphasize, and I'm sure you say this plenty in your practice as well too, if we don't get pops, but we get you looser, more mobile, and less pain, less associated symptoms, I will take all of that every day over the week versus how much did you crack.
Yeah.
And so that's really important to kind of tell some patients. I know both you and I had some nice pops. Hopefully you heard it on audio and everything, but it's really not the end all be all, right?
Right. Yep.
All right.
It may be the icing on the cake, but it's not
Exactly.
it.
Yeah. Anything else you'd like to add then?
No, that's it. Yeah. I think
Yeah.
we covered it.
Well, we appreciate you guys for
Yeah.
tuning in this month for a video. Next month, we'll pick another region of the body, kind of show the force progressions going from exercise to hands on clinician stuff. And then the next month, we'll give you like the ultimate, like, this is how it gets manipulated. So if you enjoyed this video, please like, leave a comment, subscribe to our channel if you found this really helpful. And we thank you all for continuing to support us out there.
Yeah. Thank you so much. Subscribe.
Take care till next time.
See ya.